Good morning, everyone. My name is Emalie Huriaux. I use she, her pronouns. I work at the Washington State Department of Health, and I manage a section in the Office of Infectious Disease that includes several programs, including our drug user health programs, and that involves our work managing the state overdose education and naloxone distribution program, as well as supporting harm reduction programs, syringe service programs across the state with contracts, supplies, and technical assistance and training. I was asked to present to this group a presentation I've done in some other forums that's a very brief history of US drug policy. I always find it's important to know where we've been, to know where we're going, and to understand how we got to the present. And so I do this about hour-long presentation that summarizes some facets of policy in the United States over the last couple hundred years. Of course, this is not comprehensive. This is a much deeper, probably could be a 15-week college course, but just gives a little bit of a quick and dirty overview of some key features of US drug policy over the last several decades and 100, 200 years or so. My background is working in programs that serve people who use drugs. I started out in the field of public health doing street outreach with people experiencing homelessness, people using drugs, and people doing sex work. And I also used to do a lot of overdose education and naloxone distribution trainings in supportive housing settings and shelters. Um, I've also done a lot of infectious disease testing and linking people to treatment for HIV, hepatitis C, and sexually transmitted infections. And I've done a lot of federal and state policy work, um, and worked in local government and now work in a state government environment. So I'm happy to join you. Hopefully you can all see my screen. Can somebody just do a thumbs up if you can see it? Thank you. Many thumbs up. I appreciate it. Okay. And I can send out a PDF version of this slide deck after the fact that could be forwarded to all of you if you're interested in having that. So I will make sure to do that after we're done. All right. So I like to start these discussions thinking about why some drugs are legal and others are illegal. There's many drugs that are illegal that have been used for thousands of years by humans. So cannabis, which has been illegal in most states and was illegal in Washington until relatively recently. Opium, coca, and many psychedelics, they've been used by humans for thousands of years. Uh, in the United States, most of these drugs and their corollaries are now illegal. And the legality or illegality of drugs, we logic would dictate that they're made legal or illegal based on their relative risk, based on some scientific assessment. But often, what drugs are deemed legal and what are deemed illegal are not based on a scientific assessment of their relative risks, but it has a lot to do with who's associated with these drugs. I'm going to talk a lot more about that as we go through this presentation. And there is a phrase that I really like that comes from um, a book called The Harm Reduction Gap. Uh, the phrase is that we have a two-tiered and racialized approach to drugs in the United States. So I'm going to give an overview of drug policy and periods of prohibition and regulation in the United States. And really note that rather than us focusing on demand reduction, so creating situations where people aren't interested in using drugs, drug policy in the United States has focused on limiting drug supply through criminal legal interventions. And that in the book, The Harm Reduction Gap, Dr. Sheila Vaccaria calls that the two-tiered and racialized approach to drugs. And understanding this history is really critical to understanding the current overdose crisis that we're in and the persistent drug-related health disparities experienced by Native American, Alaska Native folks, Black, African American folks, and Hispanic Latino communities. So first, I'm going to lean into the 1870s through 1940s, which, is a fairly long period of time in US history. But that's really the beginning of prohibition and the first anti-drug laws in the United States. The first, maybe it's not exactly the first, but it's often cited as the first anti-drug law in the US was the San Francisco Opium Den Ordinance of 1875. And this banned opium smoking and opium dens, which were primarily in the neighborhoods where Chinese immigrants lived. It's important to note that this ordinance did not ban other forms of opium use. It did not ban opium tinctures or other ways people might use opium. And at the time, white women were actually the most common users of opium, but they were mainly using over-the-counter patented medicines that contained opium. They weren't smoking opium, and they generally weren't using in opium dens. So again, this ordinance was specific to opium smoking and opium dens, which was really, without mentioning other forms of use, which was specifically criminalizing the Chinese community. And the rhetoric around this ordinance really played on unfounded and racist fears that Chinese men used opium to seduce white women. And you can see this flyer for a play called King of the Opium Ring, where there's this menacing man standing over this white woman who is, sort of presumably out of it because she used opium. And this law was the inspiration for the federal 1909 Smoking Opium Exclusion Act, which is often cited as the first federal drug prohibition law. In 1883, there was the Religious Crimes Code. This banned indigenous traditional dancing and ceremonies, including the practices of spiritual leaders and traditional medicine. It prohibited alcohol on reservations, punishable by imprisonment for at least 30 days, but not exceeding 90 days. But there was no alcohol prohibition outside of reservations. And a lot of the rhetoric around this law was based on this myth of the quote unquote drunken Indian and the racist trope that Indigenous men in particular were violent when drunk and predisposed to alcohol dependence. There were also a series of local and state laws around the US that prohibited traditional Indigenous practices. And religious civil rights were really not restored until, nearly 100 years later, the 1978 American Indigenous Religious Freedom Act, which legalized traditional spiritual practices and ceremony. Under the act, however, many tribes did not have the First Amendment right for certain religious practices, such as sacramental use of peyote. In 1993, the Religious Freedom Restoration Act and amendments the following year permitted use of peyote for traditional ceremony. So we can see how prohibition of drugs was specifically used against Native American, Alaska Native communities in the United States. In 1906, the Pure Food and Drug Act, which regulated the labeling of patented medicines that contained alcohol, cocaine, heroin, morphine, caffeine, and cannabis, requiring labels for quote unquote addictive and or quote unquote dangerous drugs to include contents and dosage. Prior to this law, there were many patented over-the-counter medicines that could have secret ingredients or confusing or misleading labels. And it's estimated that sale of patent medicines containing opiates decreased 33% after labeling was mandated. So this sort of shows how regulation and clear labeling can be very effective, but also created a situation that allowed for the prohibition of substances and the criminalization of drugs that weren't regulated. The anti-cocaine laws really again, played on racist tropes to get passed. You can see this headline from the February 8th, 1914 New York Times. The headline says, Negro cocaine fiends are a new Southern menace. And the subheading, murder and insanity increasing among lower class Blacks because they have taken to sniffing since deprived of whiskey by prohibition. So these laws started in the early 1900s in southern states. These were directed specifically at Black men and played on the racist trope that Black men incited violence, attacked white women, and when they used cocaine, they were resistant to fatal wounds. In 1914, the Congress passed the Harrison Narcotics Act, which outlawed opiates and cocaine and limited prescribing of narcotics. Um, and this act defined narcotics as opium and coca-based drugs because of the assumption that they caused euphoria, could become habit-forming, and were associated with crime. This rationale was later used to characterize cannabis and to outlaw cannabis. The law created a registration and regulatory system for importers, manufacturers, wholesalers, physicians, and pharmacies, and it levied a tax. It also prohibited physicians from writing prescriptions for people with dependency and or addiction to keep him comfortable by maintaining his customary use. And so the Harrison Narcotics Act is the direct line between why it is so difficult for people to access methadone in the United States and why it took the United States so long to authorize buprenorphine for the treatment of opioid use disorder, is because this law really prohibited physicians for writing prescriptions for people with dependency or addiction. And experts testified to Congress in order to get this act passed. And I have experts in quotation marks for a reason, that most of the attacks upon white women of the South are the direct result of a cocaine-crazed Negro brain. Of course, there was no data to back these experts' testimony up, but these were the racist tropes that helped get the Harrison Narcotics Act passed. And then, of course, we're all familiar with alcohol prohibition and what resulted from that. Um, we often hear about anti-alcohol laws and the movement for prohibition involving some temperance groups, women's temperance groups, who were concerned about their husbands drinking and becoming violent. But there was also a really important group that advocated for anti-alcohol laws, and that were eugenicists and nativists. And these were people that believed the success of America was a result of white Anglo-Saxon ancestry. They distrusted immigrant communities and the perceived influence of quote unquote foreign cultures. And by foreign cultures, they were really thinking about Jews and Catholics. And there was a false belief among this group that alcohol consumption was a problem among immigrants and in urban areas. And this period was also a time of restrictive immigration policies. And we'll come back to this later in the talk, but think about our current conversations about immigration policy and some of the ways those are framed. So as we all probably remember from our high school US history class, the 18th Amendment in 1919 prohibited the manufacture, sale, and transportation of intoxicating liquors for beverage purposes. This resulted in some reduction in alcohol consumption, but those that continued to drink turned to organized crime syndicates and bootlegged alcohol. And some of, because this was unregulated alcohol, some of it led to blindness, organ failure, and death. In 1933, sort of seeing the result of alcohol prohibition, the 18th Amendment was repealed by the 21st Amendment. And then, sort of concurrent to this time, we start to see anti-cannabis laws. These were really, in many states, directed at Mexican migrants and Mexican Americans due to fear of immigration after the Mexican Revolution and the quote unquote marijuana menace. The idea that crimes were attributed to Mexicans and social deviants who used cannabis. In 1913, California passed the first anti-cannabis law. In 1930, Harry Anslinger, who was the first commissioner of the Federal Bureau of Narcotics, which was the precursor to the Drug Enforcement Agency, claimed that cannabis caused psychosis and violence despite scientific evidence otherwise. And he wrote a letter to Congress. I wish I could show you what cannabis can do to degenerate Spanish-speaking residents. In 1936, kind of concurrent with this rhetoric, folks may remember the anti-cannabis propaganda film Reefer Madness. So that was sort of out in the zeitgeist. And in 1937, the Marijuana Tax Act, which was the first federal law criminalizing cannabis. So, sort of into the 40s, 50s, and 60s, we start to see critiques, some significant critiques of drug prohibition. And so I'll talk a bit about that. Anslinger, who I just mentioned, who was the first commissioner, kind of to the precursor of the DEA, was hyper focused on jazz musicians. And in the 40s, he proposed rounding up jazz musicians in a nationwide sweep. And he once wrote that jazz musicians, quote unquote, reek of filth. He targeted musicians like Duke Ellington, Louis Armstrong, Charlie Parker, and Count Basie. And then most sort of famously, he targeted Billie Holiday for her drug use and this happened after her performance of Strange Fruit, which folks may recall is a song about lynching. In 1959, his agents handcuffed her to a bed as she was dying. She was a user of heroin uh, and very much targeted by Anslinger. There are many theories that the federal government found her to be a threat because of her uh, politics, because she sang a very popular song about lynching, because she was speaking about racism and policies that were hurting her community. And no surprise that these jazz musicians targeted were all Black. I think that's not a coincidence. There's a book by Johann Hari that focuses on the Anslinger uh, efforts against Billie Holiday, and a subsequent film was made based on the book. Um, and I could say much more about this, but for the sake of time, I won't. It's very interesting and very sad. There were critics who questioned Anslinger's tactics and the hypocrisy of punishing people for narcotics, cocaine and cannabis, while alcohol, tobacco, and barbiturates were loosely regulated. The New York State Academy of Medicine created a report in 1944 that found that cannabis was less dangerous than supposed, and that while there was a lot of concern that children were using cannabis. So they found that cannabis was less dangerous than supposed, and that while children weren't really using it, there was widespread use of cigarettes. This report critiqued the gateway drug theory and questioned cannabis prohibition, and apparently this report infuriated Anslinger. There was another report about a decade and a half later that was a joint report of the American Bar Association and the American Medical Association called Narcotic Drugs Interim Report of the Joint Committee. And this report questioned criminal legal approaches and advocated for trials of outpatient clinics to supply people with drugs so they would not have to buy from illicit dealers. So really leaning into this idea of regulation over criminalization. And then the 60s into the 80s is when we have the sort of formal um, codification of the war on drugs. The Controlled Substances Act of 1970 classified drugs into 5 schedules, rated by whether they had an accepted medical use, their level of potential for abuse, and their level of potential for addiction. And this law resulted in the scheduling that we still use today. The scheduling of drugs does not necessarily align with scientific evidence. So I think that's, though there's supposed to be sort of this rubric for scheduling, there's a lot of critique that it doesn't align with science. This law also included the federal drug paraphernalia statute. In 1979, the DEA introduced the Model Drug Paraphernalia Act that offered standard language to states to criminalize items deemed drug paraphernalia. And this had a direct result in the US being caught very flat-footed in response to the HIV pandemic and the necessary distribution of sterile injection equipment to people who were sharing supplies and transmitting HIV. And more recently, this Model Drug Paraphernalia Act, which most states have a version of in their state law, has really hampered the ability of states to respond to the overdose crisis via the distribution of drug checking equipment. Because in most states, drug checking equipment is considered paraphernalia. And we've had some changes in Washington I can speak to later if there's interest, but the Model Drug Paraphernalia Act is mimicked throughout most states in the United States. Then we have the actual formal war on drugs that President Nixon declared in June of 1971. And this dramatically increased the size and the presence of federal drug control agencies. This pushed through measures such as mandatory sentencing and no-knock warrants. And folks may recall a no-knock warrant is what resulted in the murder of Breonna Taylor, where police started shooting into her home and coming in without knocking and without declaring who they were or why they were there. She was asleep in her bed. When this pronouncement was made, this temporarily placed cannabis on Schedule 1, which is the most restrictive category of drugs. And this was supposed to be temporary pending review by a commission that Nixon appointed. The following year, the commission unanimously recommended decriminalizing the possession and distribution of cannabis for personal use, but Nixon ignored the report and rejected the recommendation. And in 1973, he created the Drug Enforcement Administration, the DEA. And so this is beyond the time or scope of today's presentation, but it's important to note that the war on drugs has been a really important instrument for intervention over Indigenous people and land throughout South America. Some people call it cultural warfare and drug demonization. And the US has taken a very hardline approach to the indigenous use of plant derivatives in international conventions. For example, the traditional use of coca. So this, the war on drugs has both a domestic impact, but it's had a really important global impact as well. And I won't have the time to speak to that, but I did want to make a note of it. And then John Ehrlichman, who was an important aide to Nixon and who happened to be born in Tacoma, was quoted in an interview that was a 1994 interview that ended up being published in Harper's Magazine in 2016. And it's a very famous quote, and folks have probably heard it. You want to know what this, meaning the war on drugs, was really all about? The Nixon campaign in 1968 and the Nixon White House after that had two enemies, the anti-war left and Black people. You understand what I'm saying? We knew we couldn't make it illegal to be either against the war or Black, but by getting the public to associate the hippies with marijuana and Blacks with heroin and then criminalizing them both heavily, we could disrupt those communities. We could arrest their leaders, raid their homes, break up their meetings, and vilify them night after night on the evening news. Did we know we were lying about the drugs? Of course we did. And you can see this is a graph of male incarceration for people sentenced under state and federal jurisdiction per 100,000 people from 1925 to 2017. And you can see 1971, when Nixon declared the war on drugs, from then on, the male incarceration rate increased almost 5 times. So the direct result of U.S. drug policy resulted in an exorbitant increase in incarceration. And in the 80s into the 2000s, the kind of war on drugs was expanded and continued. 1984, we saw the Comprehensive Crime Control Act, and this created the asset forfeiture program. And the folks may be familiar with this, where people's house, car, bank account can be seized. There had been asset forfeiture before, but this law expanded civil asset forfeiture, meaning that law enforcement could seize property without charging someone with a crime. And there are concerns about due process and civil rights. This law did result in a dramatic increase in forfeitures. And what it also provided for was called equitable sharing, meaning local law enforcement agencies got a kind of piece of the assets that were seized. And this also resulted in local law enforcement agencies starting to have the resources to purchase military grade equipment. We've heard about local law enforcement agencies with things like tanks, et cetera. So this created a lot of revenue for local law enforcement agencies. And this law also included bail reform provisions that created a new standard for pretrial release. It makes it difficult for poor defendants who are presumed innocent until they go to trial and are convicted. Makes it difficult for them to make bail. And this leads many defendants to accept plea bargains to get out of jail rather than going to court. So a lot of critiques of the Comprehensive Crime Control Act of 1984. The 1986 Anti-Drug Abuse Act, you may not know the name of the law, but this is the law that many of you may be familiar with, the fact that there's much harsher penalties for crack cocaine versus powdered cocaine. So this set penalties for crack cocaine at 100 times harsher than for powder cocaine convictions, even though the effects of crack are no more harmful than powder cocaine. 85% of those sentenced for crack offenses were Black, even though most users of crack were and are white. In 2010, there was some efforts to address this disparity. The legislation passed reduced the sentencing disparity from 100 to 1, meaning 5 grams of crack would trigger an automatic 5-year sentence, while 500 grams of powdered cocaine would merit the same sentence. So it tried to address that disparity, but there's still a disparity. It exists. It's about 18 to 1 instead of 100 to 1. And there's a really good article by Professor Carl Hart, how the myth of the quote unquote Negro cocaine fiend helped shape American drug policy. So if you recall, I mentioned that New York Times article headline about the Negro cocaine fiend. You can see that into the 80s, the trope of that idea still shaped drug policy and shaped this disparity in crack versus powdered cocaine convictions. This law also involved mandatory minimum sentences based on the amount of drug involved. So a possession of 100 cannabis plants received the same penalty as possession of 100 grams of heroin. And a later amendment to this law added this 3 strikes rule, requiring life sentences for people with repeated drug offenses. So if people had 3 felony convictions for drug possession, for example, they would be sentenced to life in prison at the 3rd strike. There's a book called The New Jim Crow that many folks might be familiar with, Mass Incarceration in the Age of Colorblindness by Michelle Alexander. And this book outlines how the war on drugs policies and incarceration for drug offenses that target Black people, particularly Black men, really fueled mass incarceration and has decimated communities. And her thesis is that while the laws are colorblind in words, meaning the laws don't say something about, Black people are convicted for something more than white people, right? The laws aren't specific to race or ethnicity in their words. They are not colorblind in their enforcement, and that's created a contemporary caste system. And also part of her thesis is that the laws replicate the effects of the Jim Crow segregation that happened in the South through legal barriers to employment, housing, educational loans, voting rights, et cetera. So, when people have a felony conviction, they're often not eligible for food assistance. There's many jobs they can't access. They may not be eligible for federal housing programs, federal student aid, and in many places, they'll be disenfranchised and unable to vote. And you can see the racial disparities in incarceration rates. This is the number of people incarcerated in state and federal prisons per 100,000 based on racial and ethnic category. And you can see that Black, American Indian, Alaska Native, and Hispanic Latino communities suffer disproportionately high incarceration rates. And it's no surprise they also have the highest drug overdose mortality rates among US ethnic and social groups. And you can see that from the CDC graph. In Washington, of course, American Indian, Alaska Native communities have the highest rate of overdose deaths, much higher than any other group, and then followed by Black African American communities. And there was an important report from the Pew Charitable Trust in 2017 that really found that more imprisonment does not reduce state drug problems. So this was a report sent to the President's Commission on Combating Drug Addiction and the Opioid Crisis. And the report, with a review of all the available data, found that there was no statistically significant relationship between state drug imprisonment rates and three indicators: self-reported drug use, drug overdose deaths, and drug arrests. So it didn't matter if states had very punitive drug laws and imprisoned lots of people or not. Imprisoning people did not have any relationship to reducing drug use, death, or arrest. So an important finding from a very robust review of all available data. And there is increasing emerging data that incarceration increases the risk of overdose. So almost 1 in 5 people in federal and state prisons, local jails, juvenile correctional facilities, and immigration detention facilities are there for drug offenses. Most of them are there for simple possession. It's estimated that 60 to 65% of people in state prisons and in local jails meet the diagnostic criteria for a substance use disorder. And the risk of opioid overdose in the first 2 weeks after release from jail or prison is higher than other periods of time. And that's likely due to change in tolerance. When people are either voluntarily or forced to withdraw from opioids and then go back to use, their tolerance is low, and the amount they might have used before without a risk of overdose could cause an overdose and death. So that just being put in jail or prison increases risk of opioid overdose. And similarly, treating opioid use disorder without medications like buprenorphine or methadone is more harmful than no treatment at all. And there's a lot of issues with court-mandated treatment when it's abstinence-based treatment. Forcing people into abstinence is more harmful, or into abstinence-based drug treatment if they have an opioid use disorder. The evidence really shows is more harmful than doing nothing at all. Folks may have heard of this phrase, the iron law of prohibition. And this was coined by Richard Cowan in 1986. And it suggests that as law enforcement efforts to restrict a substance increase, the potency of that drug tends to increase as well. And that's really because of the need to avoid detection, which leads to efforts to produce drugs that have less weight and less volume and are easier to hide, store, and transport. And so we've seen that with the coca leaf or coca tea, kind of transforming to powdered cocaine, transforming to crack. We've seen that with opium to heroin to fentanyl. We've seen that with sort of beer and wine, fermented plants to spirits to moonshine during alcohol prohibition. And we've seen that with ephedra, the plant ephedra, to amphetamines to methamphetamines. So many examples of this. And thinking about our current overdose crisis, there's sort of a popular way of describing what's happened as the 4 waves of the opioid overdose crisis. So the early 2000s with the increase in prescription opioids and the narrative of that we're all very familiar with Purdue and the other pharmaceutical companies marketing opioids for pain. We saw opioid prescribing declining in the kind of 2010 to 2014 as there was the realization that this level of prescription opioid use was not safe. The prescribing declined, but many people who were not given access to evidence-based substance use treatment turned to heroin, turned to the illicit market because of their dependency. And then we saw in 2014, the introduction of fentanyl, of illicit fentanyl, I should say, into the East Coast drug supply, and that moved west. So it kind of came to the West Coast a little bit later. And now we're really in this polysubstance era where we're seeing overdose deaths due to the combination of fentanyl and other drugs, for example. There's a very good article called Today's Fentanyl Crisis, Prohibition's Iron Law Revisited, where 2 attorneys, Leo Beletsky and Corey Davis, describe the shift in the U.S. opioid overdose crisis from that prescription drug issue to heroin to illicitly manufactured fentanyl and sort of the unintended but predictable impact of supply side interventions on the illicit drug market. So fentanyl is much lighter than heroin. It's much easier to smuggle. And then also the literature is starting to reveal what's being called drug bust paradox. And there's a recent study in the American Journal of Public Health that shows that opioid overdose deaths doubled after major drug busts in Indianapolis, Indiana. And that was likely because people were facing opioid withdrawal because of reduced tolerance, and they found other dealers who had supplies they weren't accustomed to due to that drug bust. And so the writers of this article really question the efficacy of supply side enforcement interventions and drug policies, whether those are really helping or are they actually paradoxically hurting. And then to sort of bring us to today, we see current events. We see a lot of discussion of tariffs and immigration policy, and a lot of the narrative around the need for tariffs and strict immigration policy is framed around fentanyl. It's framed around substances coming over the border. Most people sentenced for drug trafficking fentanyl are US citizens, but there is a narrative that has been imparted that our fentanyl crisis is due to immigrants. And so there's been some presidential declarations related to this. And just to sort of wind this up, I have spent my career working in programs that really use a harm reduction orientation to substance use. And harm reduction as a philosophy really emerged in recognition of the colonialist, racist, xenophobic foundation of US drug policy. Also, patriarchal. A lot of the narrative was about Black men, Chinese men hurting white women, right? That there was some fear for women's safety that was not really grounded in evidence, but grounded in emotion. And so recognizing this history and the way US drug policy is built impacts the public health response to substance use and people who use drugs today, and it impacts our current ability to achieve health equity. And so just really noting that as a philosophy or a movement, harm reduction is really focused on shifting power and resources to the people most vulnerable to structural violence, the people who've been hurt most by drug policy and poverty, trauma, things like that. And then at a practical level, it's really around providing services to people in a way that gives them dignity and respect and does not shame people and does not stigmatize them, that treats any positive change as defined by the person making that change, the goal. And it's meeting people where they are, but not leaving them there. So, this history of US drug policy for me really speaks to the need for a harm reduction orientation to addressing substance use so that we're treating people with dignity and respect. Lots of resources from this presentation and some other things that might be of interest to you are all here. I will get the slides out to folks so you can reference these. But some of the articles I mentioned are linked throughout and then linked here. And then this is just sort of a funny cartoon. If you ever read drug policy papers, this is a joke about the different titles. And my favorite is, have you heard of Vancouver? And in this regard, they mean Vancouver, British Columbia, because there have been so many interesting efforts to reform Canadian drug policy. And Vancouver, British Columbia has been sort of an exemplar in that way. So I just think this is a funny cartoon. And I'm sure there were questions and comments. I was not able to present and track the chat at the same time. So I will do that now and happy to take some questions. Oh, someone put that quote in the chat from from Nixon's aide. Yep, definitely will share the slides. And the Jay-Z video is really good. So when you get this, I highly recommend watching the Jay-Z video. It's only a few minutes long. Any questions, comments? I hope this was useful. I know it's a lot, this presentation is a lot of me talking at people, a little bit of a lecture. But I do think that kind of having a glance at this history is really important to understanding where we are today and also how we hopefully improve things. All right, I'm going to stop sharing my screen. And I thank you for your kind attention. And definitely can hang out for a bit if things do emerge. But I'm glad to see in the chat, seems like people found this helpful. So I'm really glad that it was useful.